Thank you very much. Let me begin the questioning and give the mic over to Senator Cassidy, and we'll go around the table. As I mentioned earlier, in my state, in our largest hospital, we have seen a huge expenditure of $125 million for traveling nurses at a time when we have more young people who want to become nurses but can't accommodate them in our nursing schools. Dr. Herbert, is that in fact just a Vermont problem, or is that a Maine problem? Is that a national problem?
Senator Sanders, it's very much a national problem. The traveling nurse situation that you described, I mean, you're exactly right. We're seeing the exact same thing in Maine. There's a number of reasons for it, but I think what you're hearing from the panel today, there's consistency in terms of the nurse educator problem, but there's also, hospitals are really strapped with the workload issues that I described earlier in terms of reimbursements, and so it's complicated. But the clinical training sites like hospitals need support to be able to accommodate more trainees, which will help with the problem.
Okay. Dr. Zanton, how are we going to give me some specific ideas as to how we get more nurse educators out there so we can accommodate the number of young people who want to become nurses?
If we could increase all the programs through HRSA, like the Nurse Corps, that would be a really concrete suggestion. Currently, almost none of our students are able to get the Nurse Corps because we are a master's program. So I think, solving all the problems that we talked about and having more simulation, passing the FAN Act would be ways of quickly trying to increase the nurse faculty abilities of this country.
Okay. Dr. Hildreth, it is widely recognized, not debated, that African Americans, Latinos, and Native Americans are underrepresented in the healthcare profession. No one debates that. What is the impact of that? People say, so what's the difference? So you have a white doctor, a black doctor, who cares? Is there a difference? What is the difference?
Thank you, Senator Sanders. The data are very clear, as my colleague referenced earlier, that when the healthcare workforce reflects the population they care for, outcomes are better. That's not to say that a white doctor can't provide great care to a black patient. That happens every single day in our country, and vice versa. But when the provider team looks like the population they're caring for, the outcomes are better. That's been demonstrated over and over again. That's what we lose by not having a diverse workforce, the best outcomes for communities.
Thanks very much. Dr. Swanee, you talked about large areas of Louisiana, in fact, all over this country, not having enough physicians, nurses, et cetera. It's a little bit outside of the scope of this hearing, although I'm going to get back to it because we have jurisdiction over the Community Health Center program. Do you think that expanding community health centers to rural areas in America would make a lot of sense?
Thank you for that question, Senator Sanders. I do. I think they're important. Ochsner is starting 13 community health centers throughout Louisiana. They serve an important need.
Are these federally qualified community health centers?
These are our own. We're going outside the federally health qualified centers. So we partner with federally health qualified centers, and we're starting our own community health centers too. We're meeting all the federally health qualified center guidelines, but it was quicker to get there into our communities to serve.
Would it be advantageous if they were FQHCs? Would it work well for you or not?
It would be advantageous if we could work with the government to make health centers like Ochsner be able to start these federally health qualified centers and spread them more quickly.
Good. Let me ask, go back to Dr. Herbert. One of the areas that we do have jurisdiction over, and I'm very strongly in support of teaching health centers, GME. And that is an opportunity to get residents out of teaching hospitals and into primary healthcare facilities. Perhaps you and Dr. Hildreth can say a word about that. Is that a good idea to expand those programs?
That's a very good idea. And because of the caps on GME funding from the federal government, states have actually stepped in and done some creative things. I mean, for example, the state of Georgia has done that. We're now working with colleagues in Maine to establish, trying to get some legislation through the state of Maine to actually directly fund GME through partnerships based in community health community hospitals, but in partnerships with the teaching hospitals. So there's some creative things that can be done. It can be done much more much more quickly if the CMS rules were changed in the way they fund GME, but there's other innovative ways of doing it. But we absolutely need more GME. This is critical not only for primary care, but for some specialty care as well. Senator Sanders and I Senator Collins and I apologize, we're talking this morning about obstetrics and the closure of obstetric units in rural hospitals and community hospitals. And again, GME is really the key to addressing these various issues.
Dr. Hildreth, do you agree, or?
I definitely agree, and as you referenced earlier, Senator Sanders, we want to make healthcare happen in the lowest cost setting possible, and that's certainly outpatient setting for primary care. So I definitely agree that more GME in those settings would be great.
Good.
Thank you.
Thank you very much.